Welcome back. Namibia has not achieved the malaria elimination goal, and cases have more than doubled compared to the 2022 endline target. This despite a marked reduction in the number of malaria cases in the country. Malaria cases decreased by 95% from over 66,000 cases in 2017 to 3,000 in 2019. For more, I'm joined by Professor Davis Mumbengeri, who is the Director of Multidisciplinary Research Service at the University of Namibia. Professor, good evening and thank you for joining us.
Good evening, thank you for reaching out.
Professor, what is the statistics state with the recent resurgence of malaria?
So what is interesting is that the malaria numbers for Namibia have generally gone down in most of the country. Malaria is heterogeneous, which means in different parts of the country, you get different amounts of malaria. So as a total, it's doubled from 2022, but in most regions, the numbers have actually gone down. It's just that about 70% of the malaria cases are in Zambezi region where I am. And this is where we're having challenges in reducing the number of malaria cases.
Mm-hmm. And talk to us about the key challenges faced in the elimination of malaria in Namibia and how your department is addressing them.
I think the key challenges to elimination in Namibia relates to what is the primary intervention for malaria. We usually prevent malaria by controlling the vector, the female Anopheles mosquito. So one of the challenges is the behavior of the mosquito. We spray houses, we sleep under nets, but then there are populations who actually, one, during the evenings, they are not indoors where the protection is. We call these high-risk populations. They're usually mobile and migrant populations, they're agricultural workers, there are young people by the cooker shop, and there are people who are traveling. So they don't have access to this protection. So this is one big issue. The second issue is importation. We do get malaria from across the border, and that is usually what leads to outbreaks. So if we're able to control importation, we're working hard with the Ministry of Health and the SADC Malaria E8 to try and identify and prevent importation. The third one is really to do with people not agreeing to have their own sprayed. When people don't get their own sprayed, they're not protected, and this leads to onward transmission of malaria. So I think when we look at those, if we can get a hold on those, then we will improve and reduce our malaria.
Professor Davis, are there any innovative approaches or technologies, being explored to enhance malaria surveillance, one, prevention, two, and of course the treatment of malaria in the country?
It's interesting that you should ask. We're actually working with the Ministry of Health, the SADC Malaria E8, the National Institute of Communicable Diseases in South Africa, and the University of California in San Francisco. As well as on another project with the Amsterdam Medical Clinic. So these two studies are basically focusing on the use of molecular tools to improve surveillance. With Amsterdam Medical Clinic, we're working on a molecular tool to diagnose malaria at very low levels. What happens is when malaria cases are low, people can be asymptomatic, they have no symptoms of malaria, but they have the parasite, and it's difficult to detect. So we're working on a molecular tool and actually doing a clinical trial to see how effective it is in a clinical setting to pick up cases of malaria. The second one is use of molecular surveillance. We're working across the borders from Umsati, Oangwena, Kavango East and Kavango West, and Zambezi region to look at populations with malaria. And then we use the molecular tools, one, to characterize the parasite. And when we're able to characterize, it's like fingerprinting. We can kind of tell where the parasite came from. Like, it's something we're working with the SADC Malaria E8 and the other countries to say parasites in Namibia have a certain genetic characteristic, and it's different from the other countries. So it will be easier for us to tell where the malaria is coming from that we're finding in Namibia. That's the first one. The second one, due to the relatedness of the parasites, we'll be able to tell where parasites are coming from. So, for example, if you have a village where we get a malaria case, we can tell in the next village whether people are having the same parasite transmitted or it's actually a different one. And what is actually interesting is the malaria parasite doesn't go very far. It only goes where the mosquitoes go. But people move from place to place and
Professor Davis, it seems we've lost Professor Davis there. We're having a sound issue. We'll be right back shortly.
Hello, did I freeze on you?
I thought we lost you for a second. Now, for the sake of time, Professor, let's just move on to our last question. With all these efforts that you mentioned, how do you ensure, the sustainability of, malaria elimination efforts in Namibia beyond the initial success so that we don't see this resurgence of cases as we currently are?
I think partnership, like we're doing with the universities, partners, and the ministry, but I think there is a strong emphasis on communities also taking ownership of malaria elimination. So people need to let the ministry spray their homes, people need to go and get tested, and we do have an intervention called reactive case detection, where people actually come to your house and test you and your neighbors. People should allow the ministry to do its work so that we pick up all the malaria cases and we're able to treat them.
Professor, thank you so much for your time and thank you for joining us this evening.
Thank you very much.
When we come back, it's time for something